Okay. I'm Danny Thompson,
I'm Gretchen Melton.
I'm Amy Hoffman.
and our project for the International Health Project, we decided to focus on the dental needs of the children in the Philippines. We felt like it was an issue that doesn't get a lot of notice and isn't something that's necessarily talked about, but it's very vital to a person's living, and it helps keep them healthy. And we found some statistics that show that 97% of 6-year-old children already suffer from tooth decay, and that 74% of 12-year-old children already have gingivitis, and that the number one reason for a child in the Philippines to miss school is because of a toothache. Um, and so that right there just kind of showed to us the need for dental health education is what we're mostly focusing on in our intervention, is the educating part of it. Um, we felt like that not only is it more difficult in the rural areas of the Philippines for people to have access to dental health care facilities, but they also don't have access to the proper education that they need in order to fully understand the importance of taking care of their teeth, and how to do that properly. Where we had a couple barriers that we felt like we needed to overcome during our process, and the first one was the cultural barrier. We felt like if a bunch of Americans came in to teach these children, they may not be as receptive. So we felt like if we could pair up with local dental schools, that would be much more productive. And we also were worried that if we weren't there, that there'd be miscommunication or just issues with facilitating it all. So we have gotten in touch with the local American dentists there as well, to help kind of overcome any barriers that might come along the way. Like I said, our main part of the intervention is education. We felt like by teaching the youth and children how to properly take care of their teeth, they'd be able to take that education throughout their life and also help to teach others. And yeah, that's kind of the reason why we chose to do the dental health.
Okay, so like Danny said, we decided to work with dental schools in the Philippines to overcome that cultural barrier, but also education barrier or language barriers, as well as financial. It would have been really expensive for us to send teams from over here, Americans over there, to teach these kids, and we felt like we found out that in the United States, a lot of dental schools, as part of their graduation requirements, have their dental students go out to rural areas nearby where the schools are, and they go out 2 or 3 times in the course of their dental program, and they go out to these areas where these people don't have access to good dental health or dental care, and they do exams and they do treatments, and they educate the people out there and get that treatment and that care out to them where they can't come in here. We thought that was a good model for what we would do here with this and this program in the Philippines that we'd like to run. So we're going to work with the Cebu Doctors University, and not only with dental students, but with dental hygiene students. They can both go, and both types of students can go out and do exams and cleanings and things like that. So they don't have to do that in the school. They're just there to educate and give and present our presentation to these kids. Not only will they go to rural areas, but they will also hit the schools in the cities as well, so that we can reach as many children as possible. And we thought this was especially great because they're Filipino as well. So they'll be able to relate to these kids, and they'll be able to really teach them on their level and be able to help them understand how important it is to take care of your teeth. They'll be able to not only present it, but also have a hands-on opportunity to show them how to floss and how to brush. Amy has more information on what our presentation is, so I'll turn it over to her.
So these are dental students that we'll be working with will be working under the direction of our missionary contact, And we'll bring our donated kits with the pamphlet included so that the children, once they are educated, will be able to remember what they learned. And they will take them to the children in the local towns and villages. They will be teaching the children the importance of oral hygiene, and they will teach them what happens to your teeth when food is not cleaned off of them and how decay can happen. They will give the children a demonstration on an enlarged set of teeth, how to brush and floss their teeth to avoid tooth decay, so that the children can actually see what the teeth, what crevices need to be cleaned. And they will talk about the importance of eating good foods and avoiding sugary foods and drinks to keep your teeth and gums healthy. And we will also make sure that translators are available if there's a dialect in a local town or village that needs to be addressed. So I'm going to go ahead and share the PowerPoint with you that we have created. Our program or PowerPoint is called Happy Teeth, and the first slide here talks about how food and deposits left on your teeth can actually decay or rot your teeth. And then it talks about the importance of brushing your teeth and flossing your teeth, and shows, gives an example of how. And then it talks about brushing your teeth 2 to 3 times a day and flossing once a day. And then it shows what's included in their kit: the toothpaste, the toothbrush, and the dental floss.
So each child, when they go out to teach, will receive a kit that they can take home in a little bag. And like Amy said, we have in here, if I can get it open. It shouldn't be that hard to open. They will each get a toothbrush and toothpaste and floss, as well as a hard copy, a paper copy, a little booklet of the PowerPoint presentation that they can take with them home as a reference. So if they forget how to brush their teeth, they can kind of look and see, and that can help remind them. These kits will be donated by Crest. They will be donating the kits for us and the supplies for the kits. That was it's a great donation, so we do not have to go out and buy all of the toothpaste and toothbrushes. Where possible, we are going to try to leave extras at the schools so that if kids lose their kits, they can get another one and they have access to more toothpaste, another toothbrush, some more floss, whatever they need. And we're going to try to keep, hopefully they can go out to a store and buy it. They are available. Those things are available in the Philippines. We just want to make sure that people have access if they can't afford it or have no other way to get that those supplies. Amy did mention, and something I failed to mention, is the missionaries we will be working with. There is a dental office over in the Philippines that is run by the church, by an American dentist. That's his mission to have opened. He opened this clinic, dental office, and they're going to be our boots on the ground. They're going to be our in between us and the students at the university, so that we can really troubleshoot, and when problems arise, we have somebody there that can contact us quickly, and we can get take care of any problems that we come in contact with. That's also where we will ship our supplies, and they will get those supplies to the dental students as they go out on these trips out to these schools. And that just helps us stay a little more organized, where the 3 of us will not be in the Philippines, at least not all times. So that's our coordinator. Those are our boots on the ground. we have decided to fundraise to be able to pay for this project, the things that we do need to pay for, shipping and other incidentals, other costs that we may come upon. We are going to collect donations from local dentists here in the States in our respective cities to help run our operation. We are also organizing a fundraiser through a local yogurt shop. A lot of schools will do that to raise money for their schools, and we've decided to do the same, where they have set aside certain dates where when people come in, a percentage of what people spend will go to benefit our cause. We also thought this was a great way to get our communities involved in our international health program and this project that we're doing. I know a lot of people that want to help, that want to find some way to serve others and to get involved, and we thought this was a good way for people to get involved. We're just really excited about this project, to be able to help kids understand the importance of oral hygiene and good dental health. It really can affect your life, and having a great smile makes you feel good about yourself, and having healthy teeth makes you feel good. So we're hoping that this is a success, and we're just excited to do it. You ladies have anything to say?
I just wanted to add one thing about why we feel like this program and intervention is so important. That I saw the other day an article from the Mayo Clinic talking about how, and I've seen many articles about this, about how good oral health can really help prevent a lot of diseases, and when you have poor oral health, it can heighten your risk of diabetes, stroke, heart disease, and there was a whole list of other things that poor oral health contributes to, just over general health-wise. And when I read that, it just made me really feel like our program is so important, that teaching children at a young age the importance of brushing their teeth can become a daily habit and ritual for them, and they can pass that on to their other kids. So I just think that we chose an issue that really does need notice, and hopefully our intervention would work.